Today's conversation is on preconception care, and I am joined by my colleague, Dr. Sarah Zadek, and she'll be talking about what preconception care is and where it really fits in the fertility journey, egg and sperm quality, hormones, and really what the conversation is around all of those aspects to support outcomes. So I want to welcome Dr. Zadek and thank you for being with us today.
Oh, thank you very much for having me here today. I'm really excited to be talking about preconception healthcare today. So like Christina said, I'm Dr. Sarah Zadek. I'm a naturopathic doctor here in Ontario, working with Conceive Health, which is a naturopathic team located in trio fertility locations. So, our main location is downtown where we have the IVF clinic and the IUI clinic. And then we also have naturopaths situated kind of around at the trio satellite locations as well. This is a really kind of neat, new-ish integrative model. So Conceive has actually been around now for 10 years. They're just celebrating their 10th anniversary next month, which is really exciting. But what I love about this model is the integration between naturopaths and medical doctors. So we actually get to work very closely together and making sure that patients really do have all aspects of their health and their fertility kind of taken care of. And that's where today's talk about preconception health comes in, because this is everything that sometimes the medical doctors or fertility specialists don't have time to go through all the minutia and all the details of other aspects of health, getting you prepared for wanting to try to conceive or maybe starting an IVF or an IUI cycle. So that's where we come in.
Yes. And Sarah, I think that's so important, the fact that you highlighted that different practitioners are going to facilitate different conversations. So it's so important to have such a vast team around you and really supporting you, through whatever journey you're going through. And in this case, more so fertility. So with that, I'd love to sort of set the tone in terms of, answering the question of what is preconception healthcare and what is so beneficial of having that conversation.
Yeah. So what it starts with is, the amount of time that it takes for a cohort of eggs or even sperm to develop from their most kind of like immature state to for an egg to be ready to be fertilized state. I mean, there's a lot of growth and development that has to occur in the ovaries during this time. And it takes a good 100 days for those eggs to mature properly. And for sperm, it's roughly about the same time, somewhere around there, between 70 and 100 days as well. So this is the prime time. This is the window of opportunity to basically nurture and take care of that cohort of eggs or sperm. Right. So this is your 3 to 4 months of, taking care of your health, making sure you're optimizing things like, if you're smoking and need time to quit, this is your time, quit way ahead of time before you want to try to conceive. Or maybe you wanted to, develop a healthier lifestyle or a healthier diet and try to manage maybe blood sugar or if you have diabetes and getting that under control before you try to conceive. And even if you don't have any health concerns, this is still the time that you can optimize that health of those eggs and that sperm. Right. So making sure that, hormones are working optimally and making sure that, we're protecting our eggs against different kind of assailants such as, anything that causes oxidative stress and inflammation in the body. So whether it's eating things like fast food or charged foods or anything that causes inflammation in the body, alcohol, whether it's drug use or smoking. I mean, this is your chance to basically get your body as healthy as possible, to protect those eggs, give them as many nutrients as you possibly can. So optimizing the diet to include, vegetables and fruits and all those antioxidants and vitamins that it needs, all those omega-3 fatty acids, so that they can be the best versions of themselves in that cohort of eggs, so that when it is ready to be fertilized and you are ready to try to conceive, that cohort is already, in a more optimal health state. It's already going to be in a healthier state. And that's going to hopefully carry that egg on to be a healthy embryo and help that to develop and survive and end up into a pregnancy.
Yeah. You mentioned 100 days, right? So essentially we're looking at 3 to 4 months. So with that in mind, I guess, when should someone consider preconception care? Or, is there, people who may be at a certain part of their journey, is it too late for that to start to become part of the conversation?
Yeah, I think it's never too late to start to make changes. I think there are certain things that need more time than others when it comes to getting your health on track. So, for example, for people who need to lose, a very drastic amount of weight, or are kind of combating really like long-term habits. So like smoking would be a good example of that. If you've been smoking for years and you need to try to quit, you might need more time to do that. Or even after you quit, it might take your body more time to get those chemicals and get that damage taken care of. So in those cases, I mean, you might even be looking at a year before trying to conceive, to get some of that stuff on track. Now, if you're in generally pretty good health and you're young and you're just thinking about trying to conceive and just want to be, in your healthiest state, then you're probably only going to need those 3 to 4 months. And even if you're like, no, you know what, I'm pretty healthy, my partner and I maybe want to try next month, or, maybe I want to do an IUI, in 2 months, like that's okay too. You can make little changes now that have long lasting effects, or that'll even work short term. Like even something as simple as making sure your hydration is adequate, like just drink enough water, right? Or like work on sleep. Maybe you haven't been getting enough sleep lately and you just need a few more hours per night. You can work on that. Stress is another one, right? Stress can delay your period. They can delay your cycles and prolong ovulation. So something as little as managing anxiety and stressors short term can make a big impact even on the next month.
Yeah, I agree. It doesn't often have to be, like, 3, 6 months. Like little things that we put in place will, compound over time and essentially support people to achieve what they want to achieve. So, when we're talking about preconception care, you've talked about lifestyle and nutrition and sleep. And so when we're talking about all these different components, if someone is coming in, whether for the conversation of preconception care, that they haven't even started trying to conceive, or they are already in that process, what are the things that they can expect in terms of treatment or therapies or labs, as part of this process?
Yeah, it's a great question. So it all depends on where you are in your journey and what the what your goals are throughout your journey, not just the end goal being to try to get pregnant and have a healthy baby. So definitely we look at the basics, right? The diet, the lifestyle. Is there anything that we can tweak? Is there anything that we could do to optimize your health just from those like a couple little things? And this doesn't always mean a whole diet overhaul. This doesn't mean having to like join, CrossFit or a boot camp or whatever it is. You don't have to make drastic changes, but we do evaluate. And in our clinic, we do initial consults are usually about an hour to an hour and a half, depending on the person and, how much support is needed. But we like to cover those basics first. Is there anything in there that, we need to flag? Like, are you drinking 10 cups of coffee a day? And like, right? Are you like blowing past your daily amount of caffeine, and how can we help there? So that's definitely part one of it, and step one of it are those basics. The next layer on top of that is, what are you exposing yourself to that could be detrimental to your fertility or your egg health? So, everyday chemicals and everyday toxins that we don't really think too much about. Like for example, plastics. We know plastics are everywhere. And there's no avoiding it. We just live in a world where plastics make products that, are integrated into our daily lives, and that's just the way it is. But there are certain things that we can adjust our mindset around, and we can make choices when it's within our ability to do so. So for example, like drinking out of plastic water bottles, that's something that we can change, right? We can drink out of glass or stainless steel or silicone, or anything other than plastic. We can kind of make these choices for ourselves. So that's the kind of next layer on top of it. And then it's about, with egg quality, we look to antioxidant support and energy support for your eggs. And that's really what, a good, healthy, successful conception needs, or what the eggs need for that to happen, is they need enough energy and they need healthy, intact DNA that can replicate properly. If your cells can't replicate, how are you going to make an embryo, right? Like these are things that have to be in place. So oftentimes we do use supplements, and especially if someone is over the age of 35, and that goes beyond just a prenatal with folic acid, right? There's a lot of research out there right now as far as, you know, the ways that different antioxidants and nutrients can affect egg quality. So that's something that we use quite frequently in our clinic to help with egg quality. On top of that, you know, sometimes we will do testing for patients. Again, it really depends on the patient. Kind of baseline in our clinic, we like looking at, you know, ferritin or your iron stores, vitamin D, blood sugar and insulin levels, because insulin has a huge impact on egg quality. And then because we're so closely related with Trio, which is a medical facility, we do have access to hormone panels for our patients as well, which is really nice. So if you're already a patient of a fertility clinic, then it's likely that they will have run a hormone panel on you, and that'll also give us additional information if we need to do anything extra. As a bonus, or like maybe not as a bonus, but as adjunctive care on top of that, we also do acupuncture, and acupuncture is great for so many reasons. I can't express that enough, how much I love acupuncture. And I think it's because of Christina, when we were students, I mean, I used to go to the clinic like every single week and have acupuncture done, and it was amazing. And most people get a little scared, and especially in fertility, like patients who have had to do their own needles or injections all the time. And I'm like, no, this is not the same as that. This is a completely different kind of needle. It's actually a relaxation treatment, right? And it feels really good and it works, right? So acupuncture can increase your endorphins, those like feel-good hormones, right? It can help to decrease the release of stress hormones in your body, can help to regulate your sex hormones, increases circulation throughout the body, makes you feel really, really good, but it also helps with fertility. So whether you're feeling like overly stressed out, and that could be a barrier for trying to conceive, whether you're going through, you know, a medicated IUI or IVF cycle, or whether you just want the extra fun treatment of going through some acupuncture. I mean, that's a great add-on treatment when you're going through this journey.
Yeah, I think like just to add that is like just having the space to, you know, just be, because there's often so many moving parts in that journey with conception. So it's just nice to kind of have that space for yourself and process and not have to, you know, do anything, just have it be done to you. So I agree. It's a great adjunctive therapy. One thing I did want to speak to, or I would love for you to speak to, Sarah, is, you know, there's sort of two categories, and more specifically, what I'm thinking about is women with diagnosed PCOS or endometriosis, where, you know, there is more sort of concern, I guess, about fertility and what that really means for them, and is it possible? So I was just wondering if you could speak to sort of those individuals who have that diagnosis, and how would the conversation change when it comes to preconception health for them specifically?
Yeah, absolutely. And these are two kind of demographics of people who would really, really benefit from preconception care. One, because, I mean, there are two populations that will struggle more with fertility. There's just more challenges associated with PCOS and endometriosis. There's, inflammation, there's hormone dysregulation. With PCOS, like the follicles aren't even growing properly. You're not getting properly growing eggs. You can't get pregnant unless you're ovulating and it's a good quality egg. With endometriosis, there's a major inflammatory component there. And you have lesions that could be suppressing or being like literally pushing on the ovaries or these your reproductive structures, and causing them not to be as functional or as well functioning as they should be. So for PCOS and endometriosis, you especially want to do preconception care. And 3 to 6 months is, sorry, that's my dogs like losing their minds. I don't know if you can hear that or not. Hold on.
Oh, you're on mute. I think you're still on mute, Sarah. Oh, I see.
Sorry, yeah, I got stuck, so it wouldn't actually let me do it.
So good.
Oh goodness. Okay, so yeah, so basically, so endometriosis, PCOS, you might need a little bit more than that, 3 to 4 months, right? It depends on the severity of it and kind of what's going on. Because especially with PCOS, there's so many different types of PCOS. And a lot of people go around not even knowing that they have it because it can be diagnosed so differently. Like you could have high testosterone or androgen levels, but you might not. You could be normally ovulating or maybe not, right? You might have long irregular cycles, but I've also seen PCOS cases where menstruation comes regularly. So you don't know until you have this looked at. If you do already have your diagnosis or you know this is something that's going to be a challenge for you, then this is something that's exactly what we do, right? We help to improve follicle maturation into eggs. And all of that starts with PCOS, it's insulin sensitivity and testosterone levels. So that's something we can absolutely make an impact on with naturopathic care, right? With endometriosis, similarly, like we can help to suppress inflammation, we can help to suppress the growth of these lesions. So whether you're having surgery for them or whether they're small enough or few enough that you don't need surgery, it's still a treatment that we can put into place to help to make your conception more like give you a better chance of conception.
Yeah. Thank you. That was quite informative, and I think for many people, like important to take away because they may be feeling a little overwhelmed with, what that looks like. So, anyone who is joining in today, if you do have any questions for Sarah, I would ask that you please put it in the chat so we can address them and have enough time to go through those. While we wait for that, Dr. Sarah, is there anything else you'd like to leave anybody with in terms of preconception health and any last words of wisdom?
Yeah, I think with preconception care, so, I mean, this can be a long journey for some people, and it might not for others. I mean, I've seen some patients, and like literally the next cycle they're pregnant. I'm like, okay, we set you up for a 3-month protocol, but like you're pregnant now. That's great, right? And for others, it can be a year or 2 years or however long it takes. And sometimes people are successful, and other times not. But what I would kind of instill into all patients or anyone even thinking about preconception healthcare is that all of these changes, all of these treatments, they don't just impact your fertility, they impact your whole, right? These are principles, these are treatments that you can take with you and continue for the rest of your life. So however you want to build your family, whether it's naturally or adoptive or using a surrogate, however you want to build your family, or whatever that looks like to you. Maybe it's just for babies, like I've got two here, who are losing their minds. But however that is, I mean, you're creating a lifestyle and you're creating a better health setup for yourself as you age. And that's really neat, I find, with preconception care and egg quality, is that all the things we do for egg quality affects the aging of all of your cells. So again, you're kind of getting ahead of the game as far as cardiovascular health, metabolic health, neuro health, like, preventing things like Alzheimer's and dementia and cardiovascular diseases. These are all linked. So I think there's benefits even beyond conception when it comes to preconception healthcare.
Absolutely. Dr. Sarah, we do have two questions. One of them, I'm going to start with this one because I think it is a really interesting question. So the first one is, how long in advance do you recommend getting off birth control or removing an IUD before trying to conceive?
Yeah, so sometimes it depends on the person if they've ever come off of the birth control pill or IUD before and how fast it took you to get natural cycles again. So if you've done this kind of rodeo before, like I like to know what has been your experience in the past. For me personally, I once came off the birth control pill and it took me 6 months to get a cycle back. Like, so in some cases, it could take that long or longer. Now, in my case, I was fairly young and I wasn't seeing a naturopath at the time, but that's something that we can also help with, is helping to bring back cycle regulation again. So, I mean, a lot of medical studies will say, you can get off the pill and try conceiving the next month. I usually like to leave like a month break just to be like, okay, well, these hormones are out of your body, synthetic hormones, right? Let's just make sure your livers has been able to clear it away. Make sure, you know, you have a good kind of hormone reset, have one good cycle or one normal regular bleeding cycle with your own hormones and your own natural cycle, and then see what happens. And if everything's on track and you're, you know, we're good to go, then you can start trying that next cycle. But if you've ever had difficulty, you know, with the removal of an IUD or coming off of the pill, or not getting your cycles back right away, like you might not want to plan to try to conceive right away until things are normalized again.
Perfect. And the next question is, do you have any recommendations for supplements, or what to specifically look for in a prenatal?
Yeah, so the most important thing with a prenatal is getting enough folic acid, like really. I know there's a lot right now out there about the methyl tetrahydrofolate version of folic acid versus just regular folic acid. I usually use the methylated version. I will say that in most of my patients, unless they've ever had a reaction to B vitamins or folic acid in the past where it makes them anxious. So if you've ever taken a multivitamin that has that activated folic acid in it, and it's made you anxious, irritable, just not feeling like yourself, then I'll just use regular folic acid. And if you've never had a reaction like that before, I usually use the activated version or a prenatal that has both, which is kind of neat. So you're kind of hitting both pathways there. And ideally you want about one milligram. Now standard is like minimum 400 micrograms of folic acid. I see most of my patients are in their 30s or early 40s. So I'm using a good 1 milligram of folic acid. So I would say prenatal, good amount of folic acid. That's kind of the baseline that you're looking for. And I also look for one that doesn't have any like weird fillers or like food dyes. If I see like red dye number 40 or red dye number 5 or whatever it is, I'm just like, no. I don't trust a lot of food dyes. And like, yeah, weird fillers that just don't make any sense. Like cornstarches. I'm just like, no.
Yeah.
I want something clean. I want something pure. You don't need to be taking a whole bunch of added ingredients that aren't necessary.
Yeah. And I think that's, you know, one of the benefits of working with a naturopathic doctor is, you know, often the brands and products that they're recommending have been vetted. They've, you know, ensured that sort of they're to the cleanest and most optimal standards. So instead of sort of grabbing something off the shelf, that is something in terms of value with working with a naturopath. Amazing. Well, there's no more questions in the chat, but for all of you who've joined us and want to connect with Dr. Sarah Zadek, you can do so through the Health Buddha link that is in the chat, and you can connect with myself as well. Be sure to also follow Health Buddha on Instagram at Health Buddha CA for more information on the different naturopaths who are there, as well as upcoming events. Thank you again, Sarah, for joining us. It has been such a pleasure and such a wealth of information that you've shared with us today. And thank you for everyone who joined us live for our call.
Great. Thank you so much.
All right. Take care.
Bye.